mission here at the farm is to grow a healthy community by empowering people through food, education, and relationships. We grow between 10 and 14,000 pounds of food every year. Most of that food either goes to our farm stand that's in the hospital lobby on Wednesdays, or we have a produce to patients program. Several of our IHA colleagues participate in this. We have a staff community garden, so you can actually rent a plot and grow your own food here. We have our growing compassion garden, which is a flower garden, and we actually work with volunteers to make bouquets, and then they get donated to patients in the hospital. The Farm Share is like a veggie subscription service. We work with 12 to 14 local farms. We bring all that produce together, we put it in a box, and then our members get a share of our season's produce. So they get a weekly box or a bi-weekly box. Patients and members of the community who are experiencing food insecurity can actually get this program for free. People report eating significantly more fresh fruits and vegetables. Their kids eat more fresh fruits and vegetables. They're more likely to eat at home, and they feel more comfortable trying new recipes. This year, we're on track to generate well over $200,000 worth of revenue for those local farmers. Not only are we making food access easier for everyone, we're also investing in our local food economy. The gift from IHA to get a box of produce to every employee who wanted one has been really transformational, not only for the farm. About 500 people decided to donate boxes. That covers the cost for 45 families to participate in one of our 12-week seasons. So this gift is it's been great, and I love getting to meet all the IHA colleagues, and it's been fun to see people's faces light up as they pick out their fruits and vegetables. There's lots of ways to get involved with the farm. You can join the Farm Share, you can come and volunteer, you can help make donations. A monetary gift makes a big difference to how many people we can serve. So we would love to talk to you about any of those ways to get involved.
Hope isn't just our name, it's part of our mission. To make lives better, serving the whole person with free medical care, free dental care, and we're actually the first free clinic in the United States to have integrated behavioral and mental health. We served last year over 60,000 requests for help through the incredible generosity of over 1,200 volunteers. We also have the largest food program across the area. Every week we do grocery delivery to people, over 50 families. We have over 3,000 pounds of fresh fruit and vegetables delivered into our farm stands. We also do hot meals 6 nights a week. We have 4 core values we live by, and one of them is wrapped up in a Zulu greeting, and that word is sabona. And sabona means I see you, and the person responds with I am seen. Everyone who comes into the lobby at Hope Clinic is met with joy and dignity and respect. And we can't serve patients well and holistically without the many partners in our community. One of our key partnerships is with IHA. IHA is doing amazing work giving access for free to patients who don't have insurance to see a specialist. Personally, I've talked to patients who have said with tears in their eyes, saying thank you, because they would have no access to that specialty care if it wasn't for IHA. We have IHA volunteers in the food program. An IHA employee actually helped to run our Thanksgiving meal this past year. And when you ask why they want to do this, they talk about how they get more out of it than they think that they are giving. For those of you who haven't been through Hope Clinic, we invite you to come see what your support is delivering firsthand. You have made a fundamental difference in our community. You have made lives better. You haven't talked about it, you haven't put out big slogans, you've done it. And that is a profound difference. Thank you to IHA for all that you are doing.
Great Lakes Orthopedic Relief International was started by me and my partner, Dr. Mark Hake. We work at a hospital called Hospital El Buen Samaritano. It's a hospital in La Romana, Dominican Republic. The hospital is 100% funded by donations and pro bono work by medical staff. And so we do a week's worth of work seeing orthopedics patients. We have an anesthesiologist that comes down with us. We have 2 certified nurse anesthetists. In addition, we have nurses, surgery scrub technicians, and orthopedic residents. So we are surrounded by some wonderful people that take the time to do these trips with us. We see a lot of traumatic injuries that were not treated. We see a lot of congenital deformities that were not treated, and severe injuries where these injuries would absolutely be treated in the United States. Originally was the plan to go down annually. We are now going down twice a year. We would like to scale up even further. We do coordinate with an orthopedic practice out of Kansas City, but if we can bring down orthopedic groups down 4 times a year would be our optimal number. We do have a way to contact us through the website, and we are on Instagram as well. There's a PayPal mechanism in which to donate to our nonprofit. Soon those donations will be tax deductible. We'll have that up and running as soon as possible, but you can donate to our organization right now. I think the personal satisfaction of going down is the practice of pure medicine. It reminds you why you go into healthcare. You're truly taking care of people. I think anybody who goes into healthcare goes into it for that reason, to truly take care of people.
I was born in Syria, which, as you might know, is ravaged by war, has been since 2011. And I've always wanted to take some time off and possibly travel so I can work in refugee camps. IHA administration approached me with the idea of working with refugees here with the support of our local refugee resettlement agency. We started around October of 2015 with Syrian families. And because I spoke Arabic, it was easy to say yes to that. And since then, we've seen hundreds of refugees from all over the world.
Many of the refugees who are coming over are coming from trauma. They need to leave really quickly, especially the Afghanis who had just come. Some of them were just coming with a bag of items. That's all they had. They didn't really even have documents. It's just helping them get connected, feel comfortable, and be that medical home for them so they can get the right care that they need.
A lot of these families have seen war, devastating war. Many of them have been tortured. A lot of them may not have had access to healthcare over the past few years. Some of them have been exposed to infectious diseases such as tuberculosis. And so we look at all of that and we treat them as appropriately.
If they need anything else, then that's usually when I get involved. If they're saying like they don't have access to food right now, if they don't have access to some other like mental health needs, then I connect them with different resources through Jewish Family Services and the other community partners. It takes an effort by everyone to be doing this work, so it's really nice as a whole to come together as a clinic to be working with the families.
This has been very satisfying and very touching for me. I've become close with a lot of them. If you see them, understand the challenges that they have gone through, and you'll find people who are very, very nice and who are willing to integrate into the American society.